Today, we're talking about Lidocaine Hcl Cream. This medication is used on the skin to stop itching and pain from certain skin conditions such as scrapes, minor burns, eczema, and insect bites. It can also treat minor discomfort and itching caused by hemorrhoids and certain other problems of the genital and anal area like anal fissures and itching around the vagina and rectum. Some forms of this medication are also used to decrease discomfort or pain during certain medical procedures and exams such as sigmoidoscopy and cystoscopy. Lidocaine is a local anesthetic that works by causing temporary numbness and loss of feeling in the skin and mucous membranes. When using Lidocaine Hcl Cream, it's important to follow the directions on the package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying the cream to your skin, make sure the affected area is clean and dry as directed. Apply a thin layer of the medication to the affected area of skin, usually 2 to 3 times a day or as directed. If you are using the spray, shake the canister well before using. Hold the canister 3 to 5 inches from the affected area and spray until wet. If the affected area is on the face, spray the medication onto your hand and apply to the face. Avoid spraying near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. Do not use on large areas of the body, cover with waterproof bandages or plastic, or apply heat unless directed by your doctor. This could increase the risk of serious side effects. Wash hands immediately after use unless you are treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If it does, rinse the area immediately with clean water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, do not use this medication without consulting your doctor first. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. When using Lidocaine Hcl Cream, you may experience temporary redness, stinging, and slight swelling at the application site. If these effects persist or worsen, it's important to contact your doctor immediately. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's crucial to seek medical help right away if you experience any of the following very serious side effects: slow or shallow breathing, seizures, pale, bluish, or gray skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. Although rare, a very serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as a new or worsening rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. Remember to always consult your doctor for medical advice about any side effects. If you're in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch, and if you're in Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using lidocaine, it is important to inform your doctor or pharmacist if you are allergic to it or other similar anesthetics. This cream may also contain inactive ingredients that can cause allergic reactions, so it's best to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist before using this medication, especially if you have broken skin or an infection in the area where the cream will be applied, or if you have heart disease, liver disease, or a certain blood disorder. If you are scheduled for an MRI test, make sure to inform the testing personnel that you are using this product, as some brands may contain metals that can cause burns during the MRI. Before undergoing surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. For breastfeeding mothers, this medication may pass into breast milk, but is unlikely to harm the nursing infant. It's best to consult your doctor before using this cream while breastfeeding. It's important to be aware of any potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is inhaled or swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, reaching out to a poison control center is crucial. In the U.S., the number for the local poison control center is 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. It's important to be aware of these potential risks when using Lidocaine Hcl Cream. Make sure to use Lidocaine Hcl Cream exactly as prescribed by your doctor. It is used to relieve pain and itching caused by certain skin conditions, such as minor burns, insect bites, scrapes, and minor skin irritations. Apply a thin layer of the cream to the affected area and rub it in gently. Do not cover the area with a bandage unless directed to do so by your doctor. Wash your hands after applying the cream, unless your hands are being treated. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. Do not use large amounts of this medication, use it more often, or use it for longer than prescribed. If your condition does not improve or if it worsens, or if you think you may have a serious medical problem, seek immediate medical attention. If you are using Lidocaine Hcl Cream on a regular schedule and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. When using Lidocaine Hcl Cream, it's important to store it at room temperature and avoid freezing it. Keep it away from children and pets. Do not store the gel, foam, or spray canisters near high heat or open flame. Do not puncture or burn the container because the foam or spray canisters are under pressure. If you no longer need the product or it's expired, consult your pharmacist or local waste disposal company on how to properly discard it. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.